providing resources and comfort to caregivers. This is Caregiver Crossing.
Hello, everybody. Welcome to Caregiver Crossing. We're glad you're here with us. If this is your first time to listen to Caregiver Crossing, this is a show brought to you by Joy's House and presented in partnership with Cardon and Associates. We're here with you every week talking about all things caregiver. My name is caregiving. My name is Terry Stacy, along with Tina McIntosh, the founder of
I love you.
Joy's House.
You're so loud this morning because
She's hungover.
I just got back from traveling late last night.
She sure did.
And it's early.
She was in Scotland.
What? Are we ashamed of it?
Scotland.
No, I'm just whispering because you said about your, you just got back. I'm just kind of being kind of quiet and and a little lower toned.
Yeah.
By the way, Noah Taylor is here
With
He's
the great
our producer.
accent, with the Scottish accent.
Pretty good. It's pretty good. How was the trip?
Oh, it was wonderful. It was wonderful.
Is it beautiful? Is every
beautiful? The haggis is not good, but
that's
is
that sheep intestine?
Mm-hmm. Yep. I'm not a big whiskey drinker,
Right.
but the people are lovely. It is gorgeous. I will have stories to tell you when I'm actually awake.
Yeah.
But I will tell you one thing that I did.
Okay.
So I'm a big advocate. Now, listen, if you're a caregiver and you're like, what does this have to do with caregiving? Nothing and everything.
Okay.
I'm a big advocate for just doing some weird things. Okay.
Good for you. Just anything.
Yeah. I'm usually up for whatever. Like, make it weird, I'm in. So before we left, unbeknownst to my husband, I had some temporary tattoos printed of Jeff and me together when we were younger, us with the kids, just some random, right? 50 of them to be exact.
Oh my gosh. 50 of them.
Yeah. So, and along the way, I asked random people that we would meet to put them on. So like, the bartender, as he went to serve my husband, had one on his forearm.
As
he went to hand him the beer.
Great.
So I got to make friends all over the country.
Oh my gosh, you're so smart. Where did this idea come from? This is one we can steal from you. This is
I think
great.
just my brain one day, I was like, this would be fun to do.
So
and weird.
Before you did something, you had a tattoo that you would give to
just
a
random
random
people.
person.
Yeah, like the flight attendant.
Oh my gosh, that is so cool.
I love that these random people were just so willing to.
So willing. They were in on it, right? Like it's fun.
Yeah.
I love this idea.
Now, what he doesn't know is that I have a few left over. And I hope he's not listening on the way to church. But when he gets to church today, there may be some people with his face tattooed on them temporarily.
Beautiful.
Isn't it fun? Thank you.
That was so good,
I'm
Tina
stealing that
Bena.
idea.
I'm stealing it too.
My idea of the year.
Where do we find them? Where do we get those tattoos?
Oh, that's a great question.
Did you get them on Amazon?
I did not get them on Amazon, but you probably could. I think you can get them anywhere.
I feel like
anyway,
Etsy's always the way to
awesome.
go.
Etsy is fantastic.
Okay. All right.
Okay, so in very different news, I had sent some information to Noah a couple weeks ago. I got a letter in the mail from we'll call him Larry Smith. I know Larry Smith. He's wonderful. We'll call this guy is Larry Smith though. Larry, an attorney in Canada. I got a letter personalized with all my information on it, telling me that a Maria McIntosh had died, and there was over $10 million waiting for me because I'm the closest relative. Well, first of all, I married a McIntosh. I'm not a blood McIntosh. And I don't know this woman. And I looked up because I was like, this is a scam, but I'm going to go deep, right? I'm an investigative reporter at this
What's
very
going
moment.
on here? Yeah.
So I Google it. He's a legit person. I Google it further. This law firm is legitimate in Canada with the same address and the same phone number. I call it. He answers, hello. So it didn't go through a law firm phone number. He answered hello. He had a very strong dialect to him. And I was like, I was calling for Larry Smith. And he was so pushy and was like, send me an email. Have you sent me an email? Send me an email. I mean, it was just had scam written all over it. But you guys, I can see how people fall for these things.
I know. Especially the first few steps you took all kept leading you in the direction, this seems legitimate.
Yes.
This seems legitimate.
It was like a yellow light pointing to green for just a minute. I was a millionaire in my head. It was great. But it happens. And I know you had something happen to you recently,
I did.
too.
I had a recent scam. It was actually through my work email, but somebody was pretending to be leadership. Anybody who's a director at Joy's house, they were pretending to be them and had their name listed as that email. And they asked me if I could meet, and then they wanted to know my schedule, what I was doing, if I could help them with a project. And they were like, I need you to, specifically they said, I need you to get Sephora gift cards for a meeting I'm in right now. And
Oh my!
I really almost fell for it at
that's
first.
not even heard about this kind of a scam.
Oh, it's terrible.
And I was pretty new at Joy's house, and it was, it looked like it was coming from Tina, and I thought, well, if our CEO needs something,
bless you,
Oh.
I
I gotta think about it at least.
But wanted you to go out and go get these Sephora gift cards, and then do what with them?
I guess just send them the code.
Send them the code
Yeah.
for the cards.
Yeah.
Well,
I see.
so that's the problem, is that then they get the code. We actually
Yeah.
I had a coworker years ago who did fall for that scam. It wasn't Sephora, it was like CVS or something, but she bought $1,000 worth of her own money.
They're
And
easy
we
to fall
helped,
for.
bail her out of that, because that was not cool. It just, so they're out there. I mean, I think, the sad thing is that so many of these scams target caregivers, and they target our loved ones. And so they often have these fake inheritances, like my $10 million plus that's out there.
Yeah.
Not going to happen. Life insurance claims or lottery winnings is another big one that's out there. And then, like Noah, there are these phishing emails that you think are from somebody you trust in your organization.
Yeah.
And so do not go buy somebody a gift card. Don't wire transfer them. Don't do anything that's untraceable. And if you question something, call your bank first. I mean, call your bank. Just, know how to spot these red flags. Do you have notes on that? How to spot them?
Just to request, if you want to how to spot these red flags, okay, how to look for these red flags. So you might see unusual requests for personal or financial information. You know that. That's a red flag. Pressure to act quickly. Again, red flag. Demands for untraceable payments. Are you kidding? That's a red flag. I mean, that's really a red flag if somebody's, they're demanding untraceable payments. Listen, I want a payment, but I need it to be untraced. That's a red flag. And unverified sources, unknown email addresses, maybe unclear sender identity. These are all really important red flags to watch. And again, your mom, your dad, your grandparents, and you, obviously, Noah's 15 years old.
That is not, is that age? That is
Come on,
reverse
I'm
ageism.
I'm just saying,
17.
it really was primarily, you would see a lot of these scams going towards, but now it's
everybody.
across the board. It's everybody. Everybody's got to be careful.
Well, and I will tell you, years ago, I got one that was supposedly our energy company here in town, saying they were cutting off our power because we hadn't paid a bill. And I freaked out. I was out of state, called my husband. He dealt with it. It was terrible. Anyway, don't fall for it, people. You just do your due diligence on that. So, hey, real quick before we have to go, I want to tell you that if you are looking to find past episodes of the show, you can do that at caregivercrossingradio.org. Also, we want to thank our friends at Cardon and Associates. They are wonderful. They sponsored the show. You can learn more about them at cardon.us. But please know that they're just really good people, you guys. And we wouldn't be here on Caregiver Crossing without them, and Joy's house, quite frankly. And so they own over 20 communities. They operate them and manage in the Midwest and have over 40 years of senior living experience. And so they are providing residents with the best senior options and personalized service. So cardon.us for more information and to find a community near you. So stay put. We'll be right back with more Caregiver Crossing after the break.
Let your imagination soar with Audible. With stories across every genre, from expert advice to fantasy, you'll be inspired to imagine new worlds, possibilities, and ways of thinking. Listening can even lead to a positive change in your mood, habits, and overall well-being. As an Audible member, you'll get to choose one title a month to keep from their entire catalog, including bestsellers and new releases. Allow yourself to delve into the spooky this season by listening to classics like Stephen King's The Shining and Pet Sematary. There's more to imagine when you listen. New members can try Audible free for 30 days. Visit audible.com/imagine or text imagine to 500-500. That's audible.com/imagine or text imagine to 500-500.
Credit Karma makes building your credit straightforward and stress-free with help from our credit builder. Sign up today at creditkarma.com and start enhancing your financial health. Credit Karma, your partner in building a brighter financial future. Credit Builder Plan is serviced by Credit Karma Credit Builder and requires a line of credit and savings account provided by Cross River Bank, member FDIC.
And welcome back to Caregiver Crossing. Thank you all so much for being here. I'm Terry Stacy along with...
Oh, I'm Tina McIntosh. I was reading.
Oh, it's okay. Just Tina McIntosh is here. If you're just joining us, she's the founder of Joy's House. And if this is your first time listening, we're all things caregiver. Also, here's Noah Taylor, who produces today's show.
Hello.
Hello, Noah. And in studio with us now, everybody please welcome Leo Rafail.
Nope.
Oh, Rafail. Leo Rafail. Oh,
Nope.
gosh, Rafail would be something we could win.
Yes, it would
No, you can't win.
Isn't it Rafail?
be. It's Rafael, yes. You're
Leo
correct.
Rafail. It is.
Oh, good. Now we're welcoming him.
He's a community engagement coordinator for End Lung Cancer right now. And he is actually, I said that wrong too. It's End Lung Cancer now.
It's not like
He's-
you've been in radio
Oh
for
my
more
gosh,
than a couple
for
of years.
40
That's okay.
years, Leo. He is a really passionate advocate dedicated to raising awareness and providing vital support for those affected by lung cancer. Hello, Leo.
Hello.
Thank you for, I hope you've forgiven me for all the mistakes I made in introducing you.
I am so excited to be here.
Thank you very much. Tell us a little bit about End Lung Cancer Now.
So, End Lung Cancer Now was started by a thoracic oncologist, a lung cancer doctor, who has been interested in advocating for people with lung cancer for many, many years. 20 years ago, he and his wife started a youth lung program that I actually worked with him when I was in Youth Tobacco.
Here in Indiana? Is
Here
this
in
in Indiana?
Indianapolis, yeah. And so he started End Lung Cancer Now about 4 years ago. And the whole idea of End Lung Cancer Now is to, first of all, try to overcome that stigma that people experience when they say, oh, I have lung cancer. Because, oftentimes people just feel like they're being blamed because they happen to be smokers, which
Yep.
the reality is, the majority of people that get diagnosed with lung cancer now are not current smokers. There are a lot of people that are former smokers. There are a lot of people that are exposed to radon and other environmental issues, and more people that we're encountering that have a genetic predisposition for lung cancer. And so we're trying to overcome those preconceptions
Yeah.
and get the word out. Talk to people about early screening. It's just so critically important. Most people who are diagnosed with lung cancer, they are diagnosed in stage 4 because they find it somewhere else.
What are the symptoms then early on?
Lung cancer itself has very few symptoms. And that's why people get diagnosed in later stages. And so the whole concept behind lung screening is if you are an at-risk person. So, for instance, if you have the recognized criteria currently are if you're a 20-year smoker, if you're between the ages of 50 and 80, and if you are currently smoking or less than 15 years out, you are at the highest risk for lung cancer. Those are the folks that we know that we can best identify. In the state of Indiana, only 5.1% of those people get a lung screen. A lot of people go through the experience that my father did when he was 66.
I was going to ask you why this has been important to you.
Yeah, so when he was only a few years older than I am now, he had a pain in his back. And I happened to be in West Virginia at the time, came back, visited him for 4th of July, and he went to the chiropractor, and the chiropractor did an x-ray and said, you need to go to the hospital immediately. And the pain in his back was metastases from the lung cancer, and he died 4 weeks later.
Oh, Leo.
So he didn't have
Wow.
that chance for the early screening. So over the past 12 years, the whole idea of getting your lungs screened early, if you're at risk, get a screen. It's simple.
What is a screening?
Is it like an x-ray?
It's a low-dose CT. So you lay down, they go over you with this narrow band, and you're done.
Why don't people do it? Do they just not know it's available?
Or the doctors putting this, do we pay for that? Or is that something that a doctor can say is part of your yearly physical,
Yeah.
your annual physical? It should be and maybe isn't? Or where are we with that? Do you know?
So a lot of it is people who are tobacco users don't usually use that as their entree to conversation with their primary care doctor.
Oh,
You
it
know.
isn't something the doctor knows.
Right. And you can make a guess that someone is a smoker based upon physical characteristics,
Absolutely.
yellow teeth or whatever. You don't know for sure. So we're out there promoting conversations with your doctor. Oftentimes, when people hear that you're a smoker, the first conversation is, you need to stop smoking, which is really abrasive and confrontational, and you should be punched in the face for saying that.
Right.
You know?
Right.
But if you start a conversation with, hey, has your doctor ever talked to you about a lung screen?
And when we say smoking, when we say smoking, we're talking about cigarettes.
Cigarettes.
Or are we talking cigarettes, weed, what are those things called?
Vapor,
The vape?
Vapes.
So it's
What are
really
those
interesting.
things
So the reason this is
Forgot.
not a conversation the people usually have with cigars and pipes, for instance.
Thank you.
Those are generally not
Yeah, what
inhaled.
about that?
But those are generally not inhaled deeply. But if you look at
You puff them, right?
you
And then
puff
you
it.
kinda-
You
Okay,
puff a
okay,
pipe, you
all
puff
right.
it, you puff a cigar. You
Yeah.
don't inhale it. It's the aspect of inhaling deeply that makes it so much more dangerous for cigarettes. So there's a study that's going on right now. They don't have the final data, but the white paper they published indicates that for people that say, "Oh, I'm going to stop smoking cigarettes. I'm just going to do this vape. That'll be healthier, right?" They actually have a higher rate of lung cancer than people that
I've
continue
heard
to
that.
smoke cigarettes.
What if it's just the essential oils? Do they still?
The problem is that, first of all, they're unregulated.
Mm-hmm.
Second of all, a lot of the vapes have 2 or 3 times the level of nicotine that cigarettes do. So even if you wanted to try to stop, it's just compounded as to how difficult it is. So they say
Wow.
that it's equivalent to 1 pack of cigarettes for one of the cartridges for the vape. But if it's 2 times or 3 times and you're smoking a cartridge or 2 a day, you're taking in so much more of the nicotine, and it's so much more addictive. In addition to that, the substance that you're bringing in is a lot stickier, and that's the aspect with marijuana also.
Oh, sure.
It's a lot stickier. So I was talking to a guy that has a coffee bar and coffee and hookah bar, and he said that he has sold a lot of hookah pipes to people that bring them back and say, "Oh, it's not working," and he knew it wasn't working because they were using marijuana and not tobacco in the hookah because it's so much stickier. And that's
So
the same
think about what
aspect
that
with
does
the
in
vape.
your lungs then, right?
Absolutely.
So, okay, I know we're going to take a break here in just a minute, Noah, but you have mobile screenings too?
So-
mobile lung screening programs,
Yeah.
right?
So we are going to have
he
the
got
first.
really excited
Oh,
about the
I'm-
mobile
Yeah,
screening.
This
this
is
is really
so-
probably great news.
This is so exciting. If you look at the people that generally have poor outcomes with lung cancer, rural population, women, veterans, the Black population, Latino population, right? So we're going to be able to go out to these rural communities where they are and be able to do these lung screens for them. And the criteria that we've been talking about, insurance, Medicare, Medicaid will pay for lung screens every year for those folks. So the mobile unit, thanks to the Tom and Julie Wood Family Foundation, Julie Wood generously made a large contribution to our program, along with, because we're an initiative of the IU Simon Cancer Center. So she made a generous donation to us to be able to purchase a mobile CT unit
Love it.
Wow.
to get the staffing and all the preliminary things in place before it starts generating its own revenue, which it ultimately will.
So just pause there to say, Julie Wood, if you're listening, you are saving lives.
Absolutely.
Like you are saving lives by doing this. Thank you so much for the support.
And I'm so glad in 2003 that I paid full price for my Toyota Matrix from Tom Wood.
All right, you're hearing the voice of Leo Rafail, who is the community engagement coordinator for End Lung Cancer Now. We are going to take a break. When we come back, we're going to talk a lot more about what the organization is doing, how you can find that mobile lung screening program. I think I'd also like to hear from you too when we come back, maybe some tips on talking to your doctor.
Yeah.
And I know we have a lot of other questions too. So just stick around. We'll be back here in just a moment. You are listening to Caregiver Crossing. We're a show designed for family caregivers and the people who love them. Caregiver Crossing is brought to you by Joy's House, where Noah and I get to work in partnership with our friends at Cardon and Associates. And they have over 20 communities owned, operated, or managed in the Midwest, and more than 40 years of senior living experience. Cardon and Associates provides residents with the best senior living options and personalized care. We are grateful for what they do in the community and grateful that they believe in not only Caregiver Crossing, but Joy's House as an organization. So if you want to learn more about them, you can go to cardon.us for more information and to find a community near you. For now, stay put. We will be right back. We're not letting Leo go anywhere, and we'll be right back here with Caregiver Crossing after the break.
Okay, it's time to commit. 2024 is the year for prioritizing yourself. Begin your new smile journey with Byte, and you could start seeing results in just 2 to 3 weeks. Just order your at-home impression kit today for only $14.95 at Byte.com. Byte clear liners are doctor-directed and delivered to your door. Treatment costs thousands less than braces, plus they offer financing options, accept eligible insurance, and you could pay with your HSA, FSA. Get 80% off your impression kit when you use code WONDERY at Byte.com. That's BYTE.com. Start your confidence journey today with Byte.
Since 2013, Bombas has donated over 100 million socks, underwear, and T-shirts to those facing homelessness. If we counted those on air, this ad would last over 1,157 days. But if we counted the time it takes to make a donation possible, it would take just a few clicks. Because every time you make a purchase, Bombas donates an item to someone who needs it.
Go to bombas.com/Wondery and use code WONDERY for 20% off your first purchase. That's bombas.com/Wondery, code WONDERY.
Welcome back, everybody, to Caregiver Crossing. We're glad you're here with us today. Terry Stacy, that's who I am. Tina McIntosh is to my right and to the cross from me at our little round kitchen table is Noah Taylor. He produces. Hi, Noah. He produces the show. And sitting to my left around the kitchen table is Leo Rafail. He is a community engagement coordinator for End Lung Cancer Now, and thank you for sticking around.
I am so happy to be a part of this.
I don't feel like that before we took the break, we got done completely asking all the questions we wanted about the mobile lung screening program that is going to happen soon.
Yes. So we get delivery on the 14th of November, and we're going to have it out on the road in January.
Okay,
that's so great.
One unit.
One unit, yes.
And you'll go, what's the plan?
So the plan is we have been very strategic in where we want to take the unit with regard to people that are at highest risk for lung cancer and have the worst outcomes. So we've kind of divided the year 2025 into quarters, and we have 6 counties per quarter that we're going to go and visit with the lung cancer screening unit. So the IU Health is actually provide the clinicians and the staff for the unit itself. But as an outside organization through End Lung Cancer Now, we're going to develop relationships with communities so that we're not just the people in the black van from Indianapolis that show up, so that we are actually being able to connect with those communities and be able to help them to spread the word and improve their health outcomes.
It's a big deal. How did you guys end up with the vehicle to do this?
Well, so we are working with a half a dozen other medical providers throughout the country that have mobile units, and the donation was from the Tom and Julie Wood Foundation, and so we talked with them about what were their lessons learned, what was good, what was bad, what should we do, and so that's how we narrowed it down to a manufacturer, narrowed it down to the specs that we wanted.
Love it.
And
it's easy.
went from there.
It's easy to do. And, the one thing I want to do before we move into some other questions is encourage people to talk with their doctors. So, yes, learn about this mobile unit. It is End Lung Cancer Now, END, not IN, because it kind of sounds like in when we say it too fast, right? So End, like make it stop, Lung Cancer Now. But talk to your medical team, whoever that is, because there is, you mentioned, Leo, in the very beginning of our segment last hour, this stigma with lung cancer, and people are embarrassed and they don't lead with the, hey, I've been a smoker for 52 years. Have a conversation. It's really important, and I don't want you to wait to catch it until you're stage 4, when you can do it earlier if it's an issue.
And if it's caught early, so we had an experience last year on Veterans Day that happened to be the nationally recognized lung cancer screening day. And we did lung cancer screening up in Muncie at IU Health Ball because of it's a it's a payment thing, structure thing. It's not that, we were all excited about going to Muncie, but it worked out wonderfully.
Wait a minute, what does that mean?
Because we went to,
I love Muncie.
Oh, wait a minute, what are you
I'm
saying?
not saying
about
anything.
Muncie? No, I
I
fight
lived
you
in
are.
Muncie.
Fight,
No,
fight,
no,
fight,
no.
Muncie.
Not at
Chirp,
all.
chirp, chirp, chirp.
No, it's nothing
Wow,
against the rest
hold
of the
on,
state.
that is the most aggressive chirp chirp I've ever heard.
I
Chirp,
don't
chirp,
know what
chirp.
happened. What? I set a fire.
It should show you that we're listening to every word you say.
I know, and ready to just say, hey.
Well, thanks for being on the show, Leo. It was great.
All you folks in Delaware County, I know as a former resident of Delaware County in Muncie. We chose that because the advantage of going to Muncie. Let me restate it. Was that for people that go to IU Health Ball, they can spend $49 and get a lung scan, regardless of their insurance status.
Like the heart
fantastic.
scan.
Right, like the heart scan.
Like the heart scan.
And what that has done for heart scans, just that low price, is it? So it's which is $49.
$49.
Wait a minute,
Yeah.
but that's only at IU Ball Memorial.
So it's only at IU Health Ball, and that's why we went there because as an organization we can write a check to them and pay for it.
Listen, I would like to do I'm not a smoker, but I would like to do a $49 lung scan. I do the heart scan.
Right.
Well,
I mean,
and you
it
just
gives
said
me
it
a
too.
comfort.
It's not just that you smoke,
Right.
right? I mean, that's obviously the big risk.
Absolutely.
Secondhand smoke, big risk.
Right.
Vaping, big risk.
Right.
But there are other things that can cause lung cancer.
Right.
Because you hear that often. You'll hear that's the first question. Well, she had lung cancer and she passed away.
she smoke?
Did she smoke?
Yeah, exactly.
And it's
Exactly.
not always about smoking.
No, and I'm not proud, but I think you're going to have to keep telling me that too. Because
no,
it's so ingrained
It's
in
okay.
my brain.
I
I'm
just
not
want you to
proud
know
of it.
You might be at risk even though you don't
Right.
smoke.
So I would like to get a $49
Right.
scan. I do it for the heart scan.
think
Why
that's
wouldn't I do
good.
it for lungs? So Muncie, I'll be there. I'm coming this afternoon. Terry, you had some questions about I think
Caregivers.
Welcome
About
to Caregiver
caregivers.
Crossing.
Yeah, who may be supporting someone battling lung cancer. And are there some resources or specific resources for them?
In
Yeah.
1 minute or less.
In 1
Tell
minute or
us
less.
Everything
Okay.
we need to know.
Okay, so let me just give you a list of resources for caregivers, not just for lung cancer, because I know that that's on my shirt, but for folks that need support, general support for being a caregiver in cancer. Indiana University has what they call the Complete Life program. They have First Monday support groups. Franciscan has a program called Moving Beyond, which is an excellent caregiver group. Anyone that has someone in their life that has breast cancer, there's an organization that specifically works with African American women with breast cancer. It's called Pink Forever, Ending Disparities. And then for anyone who has any sort of cancer diagnosis, the cancer support community here in Indianapolis is a blessing and a gift.
I just wrote that down. As someone who has had cancer twice and my husband's had cancer twice, like a cancer support community, I don't feel like I've taken advantage enough of what Terry and her wonderful team are doing there. It's incredible.
Yeah.
And seek the support, right? I mean, if you are loving someone or even maybe not really liking them, but walking the journey of caring along with somebody, reach out. We keep talking about it on the show, Leo, but loneliness is so prevalent with caregivers right now.
Yeah.
And we want people to know you do not have to walk this journey alone.
Absolutely.
So find your people, man. Like find your group, right?
And if
You've been there.
And if you're a person that prefers not dealing with people in person, everywhere has remote options. That's one of the blessings from COVID is that there are so many, virtual options for support. It's just amazing. And the biggest thing that I've been telling caregivers my entire career is find your island, whatever that is. If it's driving around 465 with, AC/DC blaring on the stereo or sitting in the backyard, find your island because caregiving is not easy. It's emotionally difficult and there are a lot of aspects of your life that it touches. And so please take care of yourself and seek help whenever you can.
Amen. Leo, you are fantastic. End Lung Cancer Now. Tell us very quickly website.
endlungcancernow.iu.edu. Very simple.
.iu.edu.
Yes.
Well, grateful for you as a person, grateful for all the work y'all are doing. Thank you so much.
Thanks for letting me be here. This is awesome.
Come back and see us.
Yes, please
I will.
do.
I will.
You're listening to Caregiver Crossing, a show designed for family caregivers and the people who love them. Caregiver Crossing is brought to you by Joyce House in partnership with Cardon and Associates. With 20 communities owned, operated, or managed in the Midwest, and more than 40 years of senior living experience, Cardon and Associates provides residents with the best senior living options and personalized service. Visit cardon.us for more information and to find a community near you. Stay put, everybody. We'll be right back with more Caregiver Crossing.
T-Mobile 5G internet keeps getting better. Boost your connection to harder-to-reach places with Home Internet Plus and get internet right where you want it.
With Wi-Fi that reaches the attic, I finally have a home office.
Get a free upgrade to T-Mobile Home Internet Plus while supplies last. Home Internet Plus starts at $50 a month with autopay and any voice line. Check availability at T-Mobile.com/home internet.
During congestion, customers on this plan may notice speeds lower than other customers and further reduction if using greater than 1.2 terabytes per month due to data prioritization. After $20 bill credit plus $5 per month without autopay. Debit or bank account required. Regulatory fees included for qualifying accounts. $35 connection charge applies.
Forget one-size-fits-all diets. With Noom, you get a personalized weight loss plan that's tailored to your lifestyle. Have cravings? Food FOMO? Noom can help you lose weight while still enjoying your favorite foods. Noom's users love the flexible approach, blending psychology and biology to help you lose weight in a way that's sustainable for you. Plus, you can rest assured Noom's approach is grounded in science. They've published more than 30 peer-reviewed scientific articles describing their methods and effectiveness. Stay focused on what's important to you with Noom's psychology and biology-based approach. Sign up for your trial today at Noom.com.
Hello, everybody. Welcome. Caregiver Crossing is the show. Terry, Tina, Noah. Had some good, it was really just a great couple of segments there talking to Leo, and we sure do appreciate his time. Tina, we've got some questions for you. It's time to play Questions for Tina.
Woo! I always feel a little nervous about this.
No, don't be nervous. Just say pass. You can pass the question to Noah.
I didn't know I could pass.
Yeah, you can pass. You can even call a friend.
Call a friend, yep.
Okay.
Ready for the first question?
Yes.
What's one piece of advice you wish more caregivers heard when they first start their caregiving journey?
You do not have to do everything by yourself.
That's right.
And I think it's easy for us to think, I'll just do it myself. But then we become very lonely and isolated. Terry, you had talked recently. I can't remember if we talked about it on air or not. But in one of the forum conversations, you and I both saw the same thing. You brought it up to me before we came in
it was
studio.
3 words to describe how you're feeling about your caregiver.
Yeah.
Is that or about your caregiving journey?
Yeah.
And I was looking at some of those 3 words that many of those in this forum were talking about. 3 words, I'll give them to you. They were tired, unhealthy, thankful, exhausted, overloaded, overwhelmed, lost, empty, hurting, tired, grateful, lonely, grateful, scared, alone, tired, frustrated, angry, burned out, sad, trapped, scared, helpless, vulnerable, stressed, sore, because you're moving people and you're moving things, irritable was that one. But there's also some other ones, hopeful, loving, vigilant, thankful, privileged, needed.
But I'm hearing a lot of the loneliness in there, and
Right.
some of that happens when we're caregiving. People just fall off. They don't know how to be there when we need them. In that way, it brings up old wounds for them, whatever it is. Some people we push away, or they want to be there and we're not letting them in. I don't need any more meals brought, or no, I don't need anything from the grocery. Like when people ask the questions, take them up on something. They're trying to show you love, and just know that you don't have to do it alone and you don't have to be lonely. And loneliness is becoming a true, I don't know if I should say a true epidemic, because I think that's next level, but it's becoming
it's maybe a crisis.
It's a crisis
level
with family caregivers.
I think
loneliness.
it is.
What was the other thing we saw in there about drinking? There was
and
something
this
about
was you both of us saw this one too. And again, this was on a family caregiver support group on social media, and someone just simply wrote, "I cope with my caregiving by drinking too much." And so many people responded with, "You're not alone. I smoke an insane amount of weed every day. Gummies keep me sane," somebody said. People turn to self-medicate, someone said. Someone said food. I turn to food, junk food, and social media. That's my outlet. somebody said 5 years sober and nothing has tested my sobriety like caring for my mom. And this is real. This is real, and this is today. I mean, these are recent people putting down their thoughts, and I'm so glad that there are places for people to do that. I think that helps maybe, just knowing, again, you're not alone, and there are a lot of people going through the same thing you're going through, and perhaps that gives you some sort of comfort.
That's tough. Okay. What else? What else you got?
Oh, your turn, Noah.
All right, next question. What is an unexpected way that you found humor or laughter to lighten the tough moments of caregiving?
Oh, Tina, you're the best at this.
I mean, well, I would just say my knee-jerk reaction to this, because I think we've got a few more, like we'll fire through them, right, is just laugh. Start laughing. Start laughing, and then your loved one typically will start laughing, and then let yourself continue the laughter. They say a really good belly laugh is like doing a 20-minute stomach workout.
Oh, I did not know that.
That's why I'm so cut.
Six-pack from laughing.
You really are. It's because you're just laughing all the time.
It's laughter. But, I mean, really, I think, there are lots of places to find humor, and it's okay to laugh at them.
It is.
It's not cruel. You don't have to laugh at someone, although sometimes that does happen too. But just let yourself laugh. We hold it back so much. Don't hold it back.
It's good for your endorphins.
Go. Question 3.
How do you approach conversations about dignity and respect with healthcare providers or support staff when advocating for your loved one?
Say it to me one more time.
So how do you approach conversations about dignity and respect with healthcare providers when advocating for your loved ones?
Oh.
I'm not sure if this is the route that this person wanted to go, but this is what I'm thinking. Call ahead. Email ahead. Here are some things that are going on. Let the healthcare professional or the support staff bring them up to your loved one. Am I answering this properly? Like going in the right direction?
Yeah, I think so.
Ask your loved one for permission to be a part of the conversation.
Good.
Terry and I go in. Terry, is it okay if I participate in the conversation? Maybe I say that in front of the medical team. And she says yes. And I say, great. She says no. I shut my face.
Okay.
And that's very respectful.
It's very respectful.
Absolutely.
Good.
All right.
You get $10 for that one.
Thank you.
I think this is these are all really important. This question might be a little bit hard. How do you navigate setting boundaries with other family members who may have different opinions about caregiving?
Oh, okay. Let's role play. Who wants to pretend you're the
Let
family
Noah
member?
do it, because I've always been your family member.
All right.
All right. So just tell me something that, let's role play this.
Okay. I think that you have the wrong idea about caregiving and you're doing it the wrong way.
I'm sorry to hear
Well,
you feel that way.
He went right there. He went right there.
I'm sorry to hear you feel that way.
Hello, it's me. I'm the oldest sister. I'm not sure I like that you have all the responsibility.
I don't always like it
some
either.
of that responsibility away from you, but I'm going to take away some of your favorite responsibilities.
Well, you know what? I would actually love your help. Here is one responsibility that I could use help with, and here is another. So if you could pick from one of these, that would be great. And then if next you were going to tell me something that you did that you think I should do, my response to you would be, I am so glad that worked for you.
Mm-hmm.
I'm just not engaging in the conversations, if you notice. I'm so sorry to hear you feel that way.
And that's the end of it.
Stop.
That's it.
We don't need to.
Again, I think we always feel like we got to explain more. Stop. Just stop.
That's enough.
Yep, that's enough.
My motto for the day will be just shut your face.
Just shut your face.
All right, but on that note, we have one more.
We've got one more question for you. How do you keep track of all the medical appointments, medications, different care tasks without feeling overwhelmed?
Very poorly. No, I'm kidding. Not really. That's not true. A couple of things. One, I'm a note taker, so that always helps me a ton. But the other is Caregiver Way. Go to visitcaregiverway.com. That's our new platform. And Joy's House has a bunch of information on there. Don't want to get into that? Email me at tina@joyshouse.org. We'll send you our care kit digitally. So, that's it.
All right.
Did it. Oh, that wasn't so scary. All right, go
I
ahead.
think that was perfect. As we close the show, we just like to remind our listeners that they can contact us for more information and resources to help you through the journey of caregiving at 317-254-0828. Caregiver Crossing is supported by Cardon & Associates, with 20 communities owned, operated, or managed in the Midwest, and more than 40 years of senior living experience. Cardon & Associates provides residents with the best senior living options and personalized care. Until next time, take good care of each other.
Bye.
Bye.